So now we continue now in this tutorial with the definition of chronic kidney disease. Now we need to know that what chronic kidney disease is having different points in definition. So we have it is a state of a structural abnormality of the kidney. Structural abnormality is equal to structural abnormality of the kidney with or without functional abnormality. Structural abnormality with or without functional abnormality is equal, that is in bracket a low glomerular filtration rate characterized with or without oliguria, is equal at least for 3 months is equal. So those are the that's the definition of a chronic kidney disease is equal. So when they're asking you for definition of chronic disease, you must have structural abnormality with or without functional abnormality and characterized by oliguria, and we are going to have what at least for 3 months is equal. So those are the different elements. Now, after having a definition of the chronic kidney disease, the next step now is to find the classification of chronic kidney disease is equal. The classification of chronic kidney disease, we have the category classification of chronic kidney disease. In the category classification of chronic kidney disease, we need to know that what in the category classification of chronic kidney disease is different from the category classification of acute kidney injury. In chronic kidney disease, is classified from stage 1 to stage 5 is equal, from stage 1 to stage 5 is equal, and each of so you're going to have stage 1 to stage 5. In stage 1, you have a structural abnormality without any functional abnormality, meaning that what? Meaning that the glomerular filtration rate is greater than 90 mL per minute per 1.73 meters squared. I've told you that generally the approximate glomerular filtration rate of general population is going to be 125 to 135, but for you to be said that you are actually having a low glomerular filtration rate, it starts as from 90 mL per minute per 1.73 meters squared is equal. So when you have structural without functional abnormality, it is stage 1. Now if you have structural abnormality with a functional abnormality of 60 to 90 is equal. If it is 60 to 90, we are going to have 60 to 90, a glomerular filtration rate of 60 to 90 mL per minute per 1.7, it is stage 2. If you have structural abnormality with a glomerular filtration rate of now